Today I'm going to talk about the anatomy of the pulp chamber floor. While doing your access cavity, locating the number and position of orifices can be difficult, especially when the tooth is heavily restored, malopposed, or calcified. So, today we are going to learn some anatomy laws just to guide you in locating the pulp chamber position and the exact location and number of root canals in any individual tooth. I'm going to talk about two distinct anatomic patterns. First of all, I'm going to start with the relationship of the pulp chamber to the clinical crown, and later I'm going to talk about the relationship of the orifices on the pulp chamber floor. So there are some laws regarding the relationship of the pulp chamber to the clinical crown that you need to memorize and understand while doing your access cavity. The first law is the law of centrality, which simply means the floor of the pulp chamber is always located in the center of the tooth at the level of the CAG. The second law is the law of concentricity, which means the walls of the pulp chamber are always concentric to the external surface of the tooth at the level of the CAG. The last law is the law of the CAG. The CAG is the most consistent, repeatable landmark for locating the position of the pulp chamber. As you can see in the picture below, a specimen of a mandibular molar showing the equality of the distance of the pulp chamber walls from the external root surface. Now to the other anatomic pattern, which is the relationship of the orifices on the pulp chamber floor. For locating the orifices, we have another set of rules. The first rule is the law of color change, which means the color of the pulp chamber floor is always darker than the walls. This color difference creates a distinct junction where the walls and the floor of the pulp chamber meet. The law of orifice location. The orifices of the root canals are always located at the junction of the walls and the floor. The second law of orifice location, the orifices of the root canals are located at the angles in the floor-wall junction. And the third law of orifice location, the orifices of the root canals are located at the terminus of the root developmental fusion lines. And if you notice, the developmental root fusion lines are darker than the floor color. And now we will go on to the law of symmetry. The law of symmetry simply means if we draw an imaginary line in a mesial distal direction across the center of the floor of the pulp chamber, the orifices of the canals on either side of the line are equidistant. For example, if we look at the picture of the mandibular molar on the left, we can see one orifice that is exactly in the center of the line, and that means that we only have one canal in the distal side. While looking at the mesial side, we can see one canal is a bit shifted to the buccal, which means that there is another canal on the lingual side that is equidistant to the line in the center. And looking at the picture of the mandibular molar on the right, we can see the imaginary line in the mesial distal direction, and we can notice that there are two orifices in the distal side. One of them is in the buccal and the other one is on the lingual, and they are both equidistant to each other, and the same thing is happening in the mesial side. The second law of symmetry is, again, if we draw an imaginary line in a mesial distal direction across the center of the floor of the pulp chamber, the orifices of the canals on either side are perpendicular to it. So if we notice the two pictures, we can see that if we draw a perpendicular line at any of the canals, we can notice that there is another canal on the other side. While if the orifice is exactly at the center of this imaginary line, this means that we only have one canal on this side. So let's take a practical example on these laws. For example, we have this lower mandibular molar and we only located 3 canals. So we draw an imaginary line and we locate both the mesial canals by drawing another perpendicular line. We can be sure that they are equidistant to each other. And looking on the distal side, we can only locate one orifice, but if we can notice that it is not in the center of the line, so we draw a perpendicular line and locate the other orifice that is equidistant to it. And after removing this dentine, we will locate the 4th canal. Another example is this premolar. So we will draw the line in a buccolingual direction. We will notice that there is only one orifice in the lingual side, but we are only able to locate one orifice in the buccal side. But as we can notice that it is not in the center of the line, so for sure there is another canal that is equidistant to it. So after removing this dentine, we are able to locate the 3rd canal. And this is the last example of lower mandibular 2nd molar. If we draw the line in a mesiodistal direction, we can only locate 2 orifices that are exactly in the center of the line, so that means we only have 2 canals in this lower 7. And thank you for watching this series.